Good morning, happy Monday morning. Have a great week ahead. Just a brief description about the type of implants which suits in the particular area. So, maxillary or the mandibular arch, the implant of choice always is a BCS, that is bicortical screws. In the lower anteriors, you can easily place bicortical screws. I do place compressive implants of length 20 to 23 in the lower anterior mandible and also in the upper anterior maxilla. Sometimes I place compressive implants of thinner dia, that is 3.5. I have placed 4 dia also, but the first choice is always BCS when it comes to any area in the maxilla and the mandible if the bone is available, that is the cortical bone is available. Come to the lower posteriors in the mandibular region, so where the presence of inferior alveolar nerve is important while placing the implant. You have to measure the length from the crest till the superior border of IIN, that is the mandibular canal. The length may be, if the bone is good, maybe 16 or 18 or in sometimes you get to 21 also. In such cases you can place BCS implant, that is the first choice. So I do place a compressive implants of bigger dia for 5.5 in the lower posterior mandible. Comes to the upper posterior maxillary region, wherein the presence of maxillary sinus, so you have to carefully place the implant in the molar area. If the bone is good of 8 to 10 so BCS small screws of 10 or 12 you can place in the molars. If the floor is very close to the crest, so where you cannot place the implant of bigger length, so you can place the implants anterior to that is in the anterior wall of the maxillary sinus and in the posterior wall of the maxillary sinus. In the anterior wall, that is the premolar and canine region, you can bypass, that is the canine bypass you can do, or through the premolar pointing towards the midline you can place lengthy implants, so it will engage well. In the posterior area, there is a pterygoid implants you can place, double pterygoid you can place, or you can place tuberopterygoid implants that engages well in the pterygoid as well as in the tuberosity area. So in that way you can avoid placing the implant in the maxillary molars. So overall the implant of choice here in the maxilla as well as in the mandible is, first choice is BCS, followed by, in some areas I do prefer placing compressive implants of different size and length. Thank you.